Hi, welcome everyone. I want to welcome you to this mini workshop where we're going to be exploring a couple different topics in pain science. And I hope that this is just a little teaser to get you all excited about the content of pain that we're going to be diving a little more deeply into next month. So I hope that you'll all be joining me for that. Without further ado, I am going to go ahead and just share my screen with you all. Okay. So we are going to be, we always do a monthly workshop in adjunct to the strength and movement class that we explore together. So this month, I'm just going to be teasing, like I said, a little bit of the information that we're going to get more deeply into next month. So a couple of our objectives today that I'm hoping you will go through as we are moving through this mini presentation is first, I'd like us all to consider just, is pain real, right? Maybe some of us have heard some instances where pain may be not real. And then we're going to explore the relationship between how we're feeling and actually what shows up on our images, our x-rays or our MRIs. And actually I have x-ray up here, but we're gonna look a little more specifically into MRI images. So firstly, with all of you here, I know everybody has experienced pain. And for all of us that have experienced pain, is pain real? Yes. It's important to understand our pain is always real. Our pain is normal. It's also personal. The pain that we feel when we have something going on, say like a fractured ankle, an arthritic flare, it's personal, it's specific to us. Somebody else having the same condition might not experience that same pain. No one else can know exactly what our pain feels like, even if somehow by some magic, we had the exact same diagnosis and findings on an image. Okay, so our pain is very personal. And then the second objective that I'm hoping we can explore today is getting into this idea of relating what we see on an x-ray and how we feel. And I want you to start to think about how frequently those topics are sort of overlapped, where you have pain, you go into a clinician's office and we'll take an image and look at it with you and say, oh, there's the source of your pain right there. But I just hope to present a couple different themes to get you to start to challenge your thinking around that. Is what we're saying really the full truth in that moment? And this is really important when we start to consider that actually what we see on an image, either an MRI, an X-ray, a CAT scan, isn't necessarily highly correlated with pain. So tissue damage and pain aren't necessarily happening at the same time. And I have a wonderful example of this as a clinician. I started practicing back in 2007. And during my first year of practice, I had a couple really sort of monumental mind shifts in my practice. But I remember one was this mystery shoulder patient that I was working with. And he was a very functional, very strong construction worker by day. And when he came in to see me after work, he would say, I never have any pain. My shoulder feels great. I would muscle test it. It was strong and functional. And he said, the only time I have pain is when I sleep with my arm overhead at night. And so we worked, of course, on some different strategies so that he wouldn't sleep with his arm overhead. And we worked on some strategies to help his tissues rest and recover after his long work day. He made cabinets, and so he did a lot of overhead work and a lot of really fine work with his hands and shoulders, and a lot of heavy lifting. And after 6 weeks, he still said, I feel good during the day. My shoulder feels great. And it's just at night, really, or when I first wake up in the morning. And I sent him back to his orthopod thinking that, maybe this was a matter of some inflammation and just something we couldn't get a handle on. And the orthopedist, to their credit, decided to do an image at that time. And the results of the image were kind of astounding to me because I'll never forget it. Almost, all four of the rotator cuff muscles were either in a state of complete avulsion, a removal, detachment from their insertion, or they were in various states of tears and really mostly torn. Much of the cartilage around his shoulder was also torn. To this day, is probably the most complicated MRI findings that I've happened to see. Yet here was this person which with such little pain and such beautiful function. So that clinical experience really started to get me interested in asking, well, if pain isn't necessarily a good indicator of what's happening inside of the tissues, what is happening with pain? So that was sort of my fast and furious introduction as a clinician. And then I wanted to share with you as well this research study that was published in 2015 by Bryn Jikji. And during that study, they were really looking at what is the prevalence of common degenerative spine conditions by age. And this was a systematic review. So they started with thousands of research articles. I think some of the inclusion criteria were that they were written in English, and they boiled it down to 33 articles, and they reviewed over 3,000 individuals' images between the ages of 20 and 80. And some of the inclusion criteria for these people to have their images looked at was that all of these people were asymptomatic. And I remember reading in the study, I think there was even a question like, have you ever had even minimal pain in your back? And if people had, then those images were excluded. So this is truly asymptomatic people without any history of back pain. And this is the finding that excuse me, Bryn Jikji and his colleagues came up with. And so at this axis up here near the top, you'll see the age of the individuals that we're looking at. And this is the percentage of the people that were looked at in that age group that had these presentations. So 37% of the images of the 20-year-olds had a disc degeneration signs on an image, but no instance of pain. And look how these numbers really increase with age. And so, some of the findings was that the spine degenerations are present in increased proportions of asymptomatic individuals with age. But even with these lower ages, 20s and 30s, they're still present and common. So again, I think that this is just a very fascinating study because it starts to get us to think about, well, if it's not solely these disc herniations or presence of facet degenerations that are causing our pain, what is? And a take home that I want you to start to take away from this is just that, again, our pain is always real, it's always normal, always personal. We can't expect to know what somebody else is feeling when they're experiencing pain, even if they have the same exact diagnosis or the same exact findings. And then also just that pain and findings on images are not well correlated. And so I hope that this is sort of starting to stimulate you to become more curious about, well, then where do we know what is pain well correlated with, and how do we really start to work with pain beyond just working with what is on those images or our biomedical reality. And so that is the end of our presentation for today. I want to thank you all for joining. Again, we're going to dive more deeply into these topics into the next month, and I hope that you will all join us. Thank you so much. Take good care.